Blood transfusion. Here's a comprehensive guide on blood transfusion and its safety. The second part of this video discusses key questions about blood transfusions, including their effects, applications, and safety. Please watch it. This guide is based on common questions and World Health Organization WHO guidelines, aiming to clear any doubts about blood transfusion. Let's start. Blood transfusion is a medical procedure in which donated blood or blood components are delivered into a patient's circulatory system to treat blood loss, anemia, or specific medical conditions. Transfusions are often essential for stabilizing a patient's health, especially in emergency or surgical settings. Why blood transfusion is done? A blood transfusion is done to replace lost blood due to injury or surgery, treat anemia where red blood cells, RBCs, are insufficient, support patients with blood disorders like hemophilia or sickle cell disease, provide components like plasma, platelets, or clotting factors. Types of blood transfusions. Depending on the patient's needs, transfusions may involve whole blood, rarely used, includes all components, red blood cells, RBCs, for anemia or blood loss, platelets, for low platelet count, such as in chemotherapy patients, plasma, often given for liver disease, infections, or burns, cryoprecipitate, contains clotting factors for bleeding disorders. Blood transfusion procedure. 1. Preparation and pre-transfusion testing. Blood typing and cross-matching determines compatibility between donor and recipient blood. Informed consent. The healthcare provider explains the procedure, benefits, and risks. 2. Insertion of IV cannula. A peripheral IV cannula, usually 18G to 20G, is inserted into a vein, often in the forearm. 3. Blood administration. Blood or components are connected to the IV line and administered at a controlled rate. Vital signs are monitored throughout. 4. Monitoring during transfusion. Patients are closely observed for any signs of reaction. If reactions occur, transfusion is stopped and managed. 5. Post-transfusion care. Vital signs are checked post-transfusion, and tests may assess the effectiveness, e.g., hemoglobin levels. Possible risks and complications. While safe, transfusions can carry risks. Allergic reactions, fever, transfusion-related acute lung injury, TRALI, iron overload with multiple transfusions, infections. Key points. Blood transfusions are vital and often life-saving with careful preparation, testing, and monitoring to minimize risks. How is a blood transfusion done? 1. Preparation. Blood typing and cross-matching for compatibility. 2. IV cannula insertion. Cannula placed in vein for administration. 3. Blood administration. Blood connected to IV line. Transfusion starts at controlled rate. 4. Monitoring. Vital signs monitored for adverse reactions. 5. Post-transfusion care. IV line may be removed after assessing patient stability. Why is blood transfusion important? Transfusions are essential for saving lives during blood loss, supporting patients with reduced blood components, improving patient outcomes with adequate blood and oxygen levels, treating chronic blood disorders. To continue, please watch Part 2. Thank you.